As I said again, I wanted to welcome all of you to today's session. And since it's getting toward the end of the year, I thought I would go over client satisfaction in home care. We know that everything that we do relates to client satisfaction, but I felt it was good to just concentrate on it a little bit. So here toward the end of the year, we start looking at how well we've done throughout the year and also looking at what kinds of things we might need to correct going forward. So with client satisfaction, as I just mentioned, everything we do is part of that, all agency activities, the way your agency appears in the community, how you look to others. You always need to keep in mind that as a public organization, which is what you are a health care facility. If you have a license in the state of North Carolina, that's why you're under the health facility organization, because they consider you kind of like nursing home hospitals. You're governed by the same organization. So you have a public face that you always want to protect. And above all, your employees need to be satisfied as well. And I know you all have discovered this since you've been in business. When you have really good employees and you treat them well, they will go and ask their friends to come and work for you. That really happened for me a lot. I didn't really know that that would happen, but say I hired someone and everything was going well. And if I got a client and didn't have anyone to work with them, one of the first things I do is I would call my aides and I'd say, I have a client in this location. This is what they need. Do you know anyone? And so many times they would say, yes, my mom does this, my aunt, my cousin, let me call them. So then that often it ended up with me getting an additional employee that had not signed up with me previously. So the way that you treat those employees is really going to make a difference as to how they will ask others to work for you. So under the personalized care plans, this is really for the RNs. When the RN goes out and does that initial assessment, we just need to be sure that those care plans have those individual things that those clients need. It may be something like Miss Jones doesn't like to eat breakfast before 10 o'clock, or little things about them that tailor that care plan. Everybody probably gets a meal or a bath, but any little thing like that that you can document and put on the care plan for the aides is very helpful. At one time, we had a client, was a gentleman, and he lived with his son. They had built a whole different wing on their house for him, but he was very particular. I mean, when he got his breakfast, he wanted things sitting in a certain place, his spoon, his whatever. And I know you all have ran into those clients. And so we did a lot of hours with them. So I would use 3 or 4 different aides. So what I decided to do was document in detail his care plan. I would say for breakfast, you do this, this, and this. For lunch, such and such. This is the time you do it. This is how he wants his bath. That's a little extra work on the RN, but the gentleman had left another agency because they didn't go the extra mile to tailor that care plan. So we did that, and we kept that client for a very long time because of that. And the key is matching those clients with a compatible caregiver, not only skills wise, but the personality. That was something I really didn't expect in home care either, the importance of it. Because when you're working in the hospital or in the nursing home, you get these patients and you go into their room and you're kind and you do what you need to do and you move on. But in home care, when these individuals are going into the home every day, they really want to feel like that person is compatible with them, that they kind of like the same things, that they have certain conversations or whatever. And so it's usually not a science. Just you need to be pretty good at character and just looking at matching people up. And then I always told the clients that we will send you an aid. If it does not work out, we need you to call and let us know. I always let them know, don't consider this permanent. If it works, it is permanent. But if not, we will make I would say, we will change it. That was the very statement that I would give them. So it gave them some comfort that the first person that showed up at their home, if it didn't work out and they gave it a few days, I would ask them to give it a few days and see if we could work the kinks out. Then we would make a reassignment if should we need to do that. On communication, this is so important, you all. Every agency needs a clear point of contact for anything that client needs. Of course, your aides know that their contact is the RN or whomever else, maybe the scheduler to some extent, but the scheduler can only do so much because when it gets on the care side, the RN needs to be involved. But having that one person that funnels all of the calls, make sure that they get handled, and just make sure that someone gets back to the person. That is so key. I always try to, if a client calls about something, I try to get back to them within a few hours and sometimes right away. So responding quickly, finding out what the problem is and getting back to the individual is a key thing for everyone to do. And this, of course, is definitely going to improve your customer satisfaction. Things are not going to be perfect. There is so much that can go awry in home care because we are not machines, those of us working with the clients, and neither are they. Everybody has a personality. Certain things may happen overnight, that morning. We're bringing all of that to the table. So just making sure when things happen that there's one person, there's a clear point of contact or a way that they can get in touch with the agency and that the agency quickly responds to that need or request. You all are training your caregivers in the proper way. You're giving them everything that they need to work with those clients. So just keep that up. Sometimes you have to go back and talk to your aides about professionalism. One of the problems that I ran into a lot was that I just said we match up the aides with the client, everything is looking really good. And then they get to know the client very well and they start to share too much information about their personal lives. A lot of these clients are older women and the aide may be younger. So they kind of start looking at them like another family member. They start giving them advice and all of that. That is something we should try not to cross that line because when we come to these individuals, already they're ill, they're with us for a reason. We do not need to bring our own situation into theirs and mix it in. So just keep that in mind, is that professionalism part is really, really important, especially as the aide has been there for a period of time. And the RNs can check on that when they go in for the supervisory visits. A lot of times they won't tell you, but sometimes I had this one client, she would just sit down and start telling me, well, so-and-so's son, such and such and such. And I would be, how do you know that? So I knew that she was sharing too much information. So then you go back and ask them not to, or, don't say any more about that. On the technical skills, I know that now you all have to do electronic visit verification. Definitely if you're doing Medicaid, and most of the private agencies are doing it too, just make sure that your aides know how to use their software or any other technical things that they need. There's also technical issues with equipment in the home. We're pretty good at handling that, making sure they know. But as far as the software, make sure they know how to use it. I had gotten some reports from agencies a few years ago that when electronic visit verification became mandatory in North Carolina, that some of the aides just left the industry. They were like, I can't learn how to do that. And I don't really think they left the industry. I think they just went out and started working on their own with clients where they wouldn't have to do it. We cannot afford to lose any aide. So we want to train them, spend whatever amount of time you need to specifically train them on how to document the care that they're giving. And then are you able to provide coverage during emergencies, especially in caregiver absences? You are not always going to be able to send someone every time an aide is absent, especially most of you, as I was, you're pretty tight on the number of aides you have. You're trying to cover everything. So you may not be able to provide an aide every time there's an absence, but by all means, of course, you've told your aides, if you can't work, call and let me know. Get to that client and let them know they're not going to be able to come tomorrow. We don't have a backup, or we're looking for a backup, but we'll let you know what we come up with and follow through on that. That is reasonable. And while I'm talking about that, you all should know that when you admit these clients to home care, you should not be admitting clients who have no responsible party. And that means in case you can't get there, is there someone that will cover for them and do what they need? Because if you're with them 8 hours a day or whatever, even if you're there 24/7, there may be a time where someone, what if your aide has an accident on her way to work? Then someone in the family may need to fill in because you can't adjust quickly enough. And that's something you need to let these clients know up front is we need you as our ultimate backup because so much can happen or go wrong. And then you're doing regular quality checks with your clients because according to the licensure rules, you're supposed to visit them every 90 days, or if it's a companion client, you contact them every 3 months. On one of those contacts or visits, the aide should be in the home. You all know those rules, so the quality checks are built in. And on each one of those visits, there should be a space on your RN supervisory visit that will list if there are any problems going on. If there are things that are going on that need to be addressed, make sure that they get addressed, that that paper doesn't just, or whatever they put in the computer is just not there, sitting there, and no one does anything. Just getting back to the clients, following up, that will go such a long way for you as an agency owner. And then the family is always going to be involved. We should involve the family in care planning when we do that initial assessment. We're talking to them about what do you need, how often do you do this. Of course, they're letting us know what routines they already have, or we're setting that up with them. So definitely involve them in the initial care plan. And if the care plan changes, they should be involved in that too. And then any support or education we can provide for the family caregivers, that is such a good thing. Family caregivers really have a hard time. That's why they have us in there. But when we can provide information about support groups or any resources that can help them, that will help a lot as well. And then with pricing, if you're doing private pay, be clear and upfront about what your costs and services are. And I also want you to know it is okay to change your prices. Most of you are not going to change your prices down, but if you want to increase the price of your service, it is okay to do that. I did that a number of times, but what I did, you all, was I gave my clients a 90-day notice. Like in January, I would say, as of April 1st, your rate will increase to such and such and such. That gave them plenty of time. Most of them, if they're satisfied with your services, they're satisfied with your aid. I never had not one client to refuse to pay the increased amount or to leave the company. So you don't just call somebody or send the bill 1 month and you send it the next month and the rate has changed and they knew nothing about it. That's offensive. So I would send them a letter and let them know what the new rate was, and then we followed through on it. So that will help a lot because when it comes to money, people don't like you to surprise them there. This goes back to the 24/7 availability, goes back to the communication. Make sure that someone is answering your phone 24/7, especially if you have clients that are being serviced 24/7. Just a little further on that, for every hour that you have an aide in the home, there should be an RN accessible on call during all of those hours. Now, sometimes you may not have clients at night, but someone should be answering your phone. I used to get an answering service that I would transfer my calls to at the end of the day, and because I didn't want to answer calls all night, and they would answer the phone. Many of you, your agencies may be large enough to where you have you have RNs or nurses that are on call and they take turns. But it would be okay for you to use an answering service. But when that answering service calls, whoever the on-call person is, they need to respond. And then for cultural sensitivity, we do the best that we can with this. Um, with religious, cultural, or language preferences, I remember one of maybe the second client that I had was Filipino, I believe. Her daughter worked with me at the hospital, and I told her that I had an agency. So she asked me to send someone to help her mom in the mornings. She couldn't, this lady could not speak any English, but the aide that I sent there was so good with mannerisms and they got along so well, it never made a difference. So if you don't have an individual that speaks the language, and I think most people who don't speak English, they know that you may have to send them someone that doesn't speak the language. But with the right caregiver, you can definitely make that work. I know this aide did, and they just loved her. You know, she loved them, and we stayed with that client until she passed away, which was a few years. And so that is just really important. You know, you don't have to have someone that speaks the language, but that they can find a way to communicate. On the religious part, one of my clients was a religion that did not celebrate birthdays. So one of the things that we always did as an agency is we knew our clients' birthdays. So at the first of the month, everyone that had a birthday, say it's October, we sent every one of them a birthday card. Well, we had to be sure we knew this person did not celebrate birthdays as her religion. We made sure we flagged her file that we never sent her a birthday card. So little things like that really make a difference. I'm sure that it happened to her a lot in other ways, but we were sensitive to that. So anything like that that you know for sure, and we didn't ask her what her religion was. I think that somehow we found out during conversation and we accommodated that for her. So that's basically what I had for you all today. As I always let you all know, I'm happy to provide this information. I love doing this because it keeps us connected. But anything that I've told you today that may relate to you changing your policies or anything that you do in the community or whatever, you make sure you go to the governing authority so that you are not violating any rules outside of what I have told you. You know, we try to give you good information, but before you make a major change in your agency or your procedures, please go to the governing authority, if there is one, before you implement any of the things that we've given you today.